What are the top 7 plantar fasciitis mistakes and why so many people suffer from it? We're gonna dive into that in this video. At our clinic, we've been treating plantar fasciitis for 9 years. We've had every case get better. We've fixed every case of plantar fasciitis, and it's because we go about it differently. And so it was very easy to make this list of 7 common mistakes. So let's dive in so you understand exactly what you're doing wrong, and then we can give you clear information on what you need to be doing to actually get real results. The number 1 most common mistake is centering all the treatment around the foot. So plantar fasciitis, we have pain and inflammation on our foot. And so the information that most people get online is that you need to roll it out. So people are rolling out their foot at home all the time. I'm looking at you because you're probably doing this right now. I have so many clients, they come in and they say, I roll my foot all the time, but it doesn't seem to get better. And it genuinely makes 0 sense that inflammation is in the bottom of your foot and then we're just gonna grind on it and expect it to improve. So it's not a good solution. It's actually the wrong solution, especially for the first 2 weeks. The first 2 weeks, we wanna take pressure off of the foot. We don't wanna irritate it more. If we continue to irritate it, we're chasing the wrong thing and you're gonna stay in pain. Number 2 is only seeing a podiatrist. So a podiatrist has 4 tools. And so we have really good podiatrists in our area, but the podiatrist really only has 4 tools. They can do injections, they can give you drugs, they can do orthotics, or they can put you in a boot. And I guess they have 5 tools because they could also do surgery. And we do not want to have surgery for plantar fasciitis. It's a easily fixable problem that so many people deal with. It's absolutely plaguing the community. It's probably the number 2 thing that we treat here. But behind back pain, we see plantar fasciitis all the time. So if you're those are passive treatments. They're not getting to the root cause of the problem. So we gotta make sure we go after that root cause. So make sure you're looking for somebody, which gives me or brings me to number 3, which is seeing a physical therapist who's not experienced. When a physical therapist goes directly to the site of pain with plantar fasciitis and they have you do stretches and exercises and roll out your foot, they're following that same pattern. And I've had so many clients that come in and say, physical therapy doesn't work for me. I've tried it so many times and it hasn't worked because they're attacking the same thing over and over. And that's where they're isolating the lower leg. So they're saying, hey, well, the pain's here. So then all the treatment is spent right here in the foot and the lower ankle, but they're not getting to the root cause of the problem. And that's what I want to get to in this video. That leads me into number 4, which is not understanding why you have plantar fasciitis. So that's a huge mistake. We have to learn. You're going to be in this body the rest of your life. We need to know exactly why we're having plantar fasciitis and why it won't go away. So before we get into the exact things that you need to do, make sure you hit the subscribe button and ask us any detailed questions that you want us to dive into so we make sure you're getting productive information from the channel. Number 5 mistake is stretching the ankle daily. So stretching my foot, pulling it up, stretching my ankle all the time. You're doing that all the time. It's the same thing as grinding out the tissue all the time. We are stretching and we're pulling on inflamed tissue. That is going to irritate it more. In the first 2 weeks, it's too much stress and too much pressure. It's not helping you with the root cause of the problem. So we want to stay away from that. So that's absolutely a mistake. Number 6 is not buying in or understanding triple extension. And so triple extension is where every time we walk, every time we run, we are pushing off of our hip, our knee, and our ankle. So we're pushing off. All the 3 of those joints have to work together and the muscles have to work together. If I'm not getting enough force production from my hip, then I'm pushing too much to the foot. My foot starts to whip all the time and that's gonna overwork it. So if we don't understand that biomechanics, the movement of our body, we're doing it, walking is such a natural, innate movement for us. We've got to understand what muscles should be working and why we're losing them. And we have to backtrack it and figure out how are we gonna get that back and redistribute that load so that triple extension is happening. And that's gonna be, we're gonna be in line with the root cause of the problem and how we fix it with all these clients. Number 7 is expecting orthotics to fix the problem. So orthotics, or if this is the arch of my foot, an orthotic just comes up and is gonna give me support. And what I've seen a lot of times with a podiatrist, they'll get these orthotics from a podiatrist and it'll put pressure directly on where the plantar fascia is. So then our client will say, hey, well, I stopped wearing them because it actually made it worse. Sometimes it'll make it a little bit better, but it doesn't actually get rid of the problem. So orthotics are just another passive treatment, a passive thing that we can do that'll maybe buy you time. So I'm not saying don't get orthotics. If they're helpful to you, use the orthotics, but we've got to get to the root cause of the problem. Those are the 7 major mistakes that people make. So let's dive into the top 3 things that you need to know in this video to start moving in the right direction. If you look in the description, we're gonna have a video linked on exactly what we do in the clinic, but I want you to focus in on 3 major questions. Number 1, what muscles aren't doing their job that's making your plantar fascia and the muscles in your foot do too much work? So looking at that, it's going to be your hips. So that triple extension, pushing off. If I don't get hip drive, when I'm walking, I need to get 50% of the production from my hip. I need to get 25 at my knee and 25 at my ankle. What ends up happening 99% of the time is that we get 25% here. We're getting something from the hip. We get 25% from the knee. There's just not a lot of stuff going on right there. And then we get 50% from the ankle. We're pushing off with our ankle and our foot all the time. So we're overworking that. So what muscles are not doing their job? And we have videos on that. And then you can also ask us more detailed questions and just tell us exactly where we need to dive in, because we don't know what it looks like from your side. And we want to make sure that we're fixing this at home. Number 2 is, what stage of healing are you in? Normal healing processes happen. If we are not re-injuring tissue, then we get 50% healing in the first 2 weeks. We get 80% at 6 weeks, and we get 100% at 12 weeks. So what stage of healing are you in? Because that's gonna dictate what we should be doing specifically at this stage to make sure that we consistently move through that healing process. Number 3 is, why are my hips and my glutes not doing enough work? So there's a guy in LA at a biomechanics lab that does studies on this. So he does a brain scan and sees how much time people spend sitting. It's because these plantar fasciitis typically happens as we get older. The more time we spend sitting, the more we start to lose that connection to our glutes. So our glutes stop to fire. They stop firing, they stop being active, and then we start using more of the muscles around our appendages, away from the core of our body. And so we've got to look at that. What are our seated positions? How often is it happening? And then how many years has it been progressing? Because that'll tell us how deep of a hole we've dug ourselves in. And with consistency, you can dig yourself out of that hole. We've got to make sure that we're loosening up the right tissue, firing up the correct muscles, and then using them in a standing position and progressing to walking. As long as you're doing those 4 things, you're making sure that you're working through those progressions, which you can do with videos on YouTube, making sure you're doing the right stuff consistently, you're gonna be able to beat this and you'll be able to keep it gone. If any of those questions didn't make sense, or you said yes to any of them, or you know the answer, let us know in the comments. Make sure that you check out the video in the description, making sure that you're getting the information that you need, and let us know what videos you need and how specific we need to be with our exercises, because we want you to understand those phases of healing, and you should be able to identify where you are in the healing process and then work your way from the hips down to the leg. So the hips down to the foot, and then we will get into the foot. There is a productive time where you loosen up that tissue in the foot. It's just absolutely not when you're in a pain pattern, when you're dealing with pain. That's not when we want to break up that tissue. We want to do that once we've got rid of 80% of the pain. We start to go in lightly to that tissue, because that's where we're sealing the door. We're getting rid of it long term. So let us know in the comments, and we'll see you in the next video.